IVF stands for in vitro fertilization. This is the most commonly performed technique in a fertility clinic. If you understand it in a simple way, what happens is we take the female eggs and then the man's sperm and then put it together in a petri dish, in a glass dish, and form embryos. These embryos are then taken and put it back to the lady's womb. So this is the entire process, to put it simply. Once this process is done, then the lady can then hope to get pregnant. This treatment over the last 40 years has actually helped countless couples to get a pregnancy and have a child. There is no age cutoff that we talk of for doing IVF. As we have discussed, IVF means you take the lady's eggs and the partner's sperms and form embryos. Now the embryo quality is going to depend on the lady's eggs and the man's sperms. So if the lady is higher aged, that means there is a high chance that her egg quality may not be good. So then the embryos will not either form or will form badly. In either case, the pregnancy will not result. So what we rather say to our patients is that we can definitely try with your eggs, whatever your age may be, but be mentally prepared that higher the age, the lesser is the chance of having an ongoing pregnancy and a healthy child. In other terms, there is another test that's come out recently. It's called AMH, or anti-Mullerian hormone, by which we can predict more accurately as to what is the egg reserve or possibly the egg quality for the lady. And by doing that test, we can then predict whether she is a good candidate to try with her own eggs or she should go for donor eggs. But all said and done, all women across all age groups have a right to try with their own eggs if they so desire to get a pregnancy of their choice. IVF process has to be understood in 5 phases. First of all, we have to be sure that you need an IVF for you to get pregnant. Once we have some reason why we are doing an IVF for you, we take you through the paces of IVF. You have to understand the process in complete details because you are going to go through the process. And you have to have a full confidence in your team that they can actually take you through to a pregnancy. This is known as counseling, whereby we explain the process in medical details and also in terms of the requirements as the number of injections that may be needed, how often do you need to come to the clinic, how long do you need to wait for every visit that you make to the clinic, what may be the costs involved, what is your approximate chances of getting a pregnancy with every attempt, and so on and so forth. I would say counseling is the single most important step during an IVF process, because if you have understood your process completely and you trust us, then the rest is very easy. The third part is the ovarian stimulation, where the lady is put on some contraceptive pills to make sure that she menstruates at the right time, and then she is put on daily injections which continue for 10 to 12 days. While these injections are going on, she is advised a few do's and don'ts. She needs to stick to those. She also needs to come to the clinic 3 or 4 times for ultrasounds and monitoring. After 10 or 12 days of injections, usually the eggs in the female are ready, which is then we advise a ovum pickup. The ovum pickup process is carried out under anesthesia, so we have to first find out whether you are medically fit for that. Once the anesthesia process is over, the eggs are collected, the lady is now free. She can go back and join her normal life. Meanwhile, the man, the husband, has to contribute his semen. He gives one sample prior to the day of ovum pickup for us to check whether everything is alright or not, and to freeze a sample. Remember, many times because of the stress involved, the man may not be able to give a semen sample on the day of ovum pickup. So it makes sense to freeze a sample prior to ovum pickup. Make sure that you talk to your clinic as to whether they have a freezing facility for the man's sperms. So again, the man is required to contribute his semen on the day of ovum pickup, and once the semen is obtained and the eggs are obtained through the process of ovum pickup, now the lab work starts. So the eggs and the sperm that has been collected on the day of ovum pickup are now processed, cleaned up and handled in the lab under extreme sterile conditions. We make the eggs and the sperms either come close, or we actually inject one sperm into one egg under the cover of a microscope to form embryos. These embryos are then cultured in special incubators. We maintain a very distinct temperature and environment for these embryos to grow properly. Once these embryos have grown sufficiently for 2 days or 3 days or even 5 days in some cases, we then have embryos ready to be transferred to the lady's womb. Now generally people are divided into two categories. There are some women who would like the transfer to be done 4 or 5 days immediately after ovum pickup, and there are some women who want to get the transfer done in the next month. We are okay with both. Once we have formed embryos, we can either freeze them and use them for the next month or transfer them directly in that very month on the 4th or the 5th day of formation. Once the lady has been transferred the embryos, she is again given another set of advice, medications to follow, and asked to come back after 14 days to find out whether she is happily pregnant. If she is, she needs to continue her medications for 3 months and then consult an obstetrician. If she is not conceived this time, there is always a second time around. So this is what we have to remember, that IVF may not succeed every time, but it definitely succeeds over a couple of attempts for most couples. So to summarize, an IVF process is comprising of these following stages. First, to find out if you require an IVF, then counseling, then ovarian stimulation followed by ovum pickup, and then embryo transfer, and then luteal support, that is some medications that continue for as long as 3 months to maintain the pregnancy. This is IVF in short for you. Natural conception happens when a lady forms an egg in either of her ovaries, and that egg is released on the 13th or the 14th day of her cycle, is picked up by the fallopian tube, and the egg stays put in the tube for 12 to 14 hours. And during this 12 to 14 hours, if she has intercourse with a partner, and enough sperms can travel all the way up till the egg and fertilize it. So it's very important for a lady to conceive naturally to have healthy and what we say patent fallopian tubes, which is the tube is allowing the egg to enter from one side and the sperms to come from the other side, so that the egg and the sperm can meet and get fertilized. However, in case the tubes are damaged, they are blocked, or they have been surgically cut because of some reason, then there is no chance that the eggs and the sperms can meet each other, and then there is no way that she can get pregnant naturally. Happily, she does have the option of going for an IVF, where we take the eggs and the sperms outside of the body and make them meet together in a petri dish. Very unromantic, but then very practical. So this is another way where we can help them to conceive through IVF. But if the tubes are surgically tied, she has only one way of getting pregnant, and that's IVF. The cost of an IVF depends on the amount of medication that may be necessary to give the ladies to eggs to get ready, and the process of IVF. Sometimes there are advanced procedures also required depending on the lady's condition and her age. In a ballpark sort of a way, I would say the cost of an IVF could be as low as 75,000 rupees to as high as 1,75,000 rupees, depending on the amount of medication and the procedure that is necessary to try and form healthy embryos. In the process of IVF, it's very important that we give her medications to produce more than one egg. Quite often the medications make her produce 8 to 14 eggs or even more. These eggs are then matured over 10 or 12 days by giving her multiple injections, and during this time she is called for multiple ultrasounds to monitor growth of these eggs. Once the eggs have achieved maturity, which we know by the size of the follicles, they should have crossed 17 millimeters at least in size. That's when we decide to go for egg retrieval. The process of egg retrieval in itself is very simple. The lady is put under a light anesthesia. She need not be under some heavy medication for this. And then a needle is introduced through her vagina with the help of an ultrasound guidance, so that these eggs are then punctured and collected directly from the vagina. There is no cut or injury to her body parts. She can get up and go within 2 hours of egg retrieval, and in most cases she is absolutely free to start her normal life from the next day onwards. On an average, a lady requires anywhere between 9 to 11 days of starting ovarian stimulation for her eggs to get ready. So if somebody had her menses on the first of the month and we have started her injections from the second of the month, it's usually going to be 10 or 11 days of stimulation. So her eggs are going to be ready by the 11th or the 12th of the month, and we're going to take out her eggs 1.5 days later, so either on the 12th or the 13th of the month. So that's what you have to remember. It usually takes around 12 or 13 days of total preparation before the eggs are mature and are taken out of the body. See, the IVF process involves ovarian stimulation to produce multiple eggs, then ovarian extraction, a forming of embryos, and putting it back to the lady's womb. While the ovarian stimulation is going on, she needs to come to the clinic for multiple ultrasounds on 3 or 4 occasions, and she needs to take injections at the same time every day. While these injections are not causing her any bodily issues, some women may have some emotional ups and downs. It's best that she sticks to the routine that she always had and not introduce anything new to her system. We ask women to refrain from heavy duty exercises, but normal light exercises that one has been doing for long can easily be continued and are absolutely not contraindicated during ovarian stimulation. After ovum pickup is carried out, she can have completely normal life, but after embryo transfer has been carried out, we do ask the patient to refrain from heavy exercises and only stick to the light exercises like walking or treadmill. See, this is $1 million question. It's very difficult to define success in abstract terms. We need to know the lady's age, why are we doing the IVF, what is the quality of the eggs, etc., etc., etc. Again, on a ballpark basis, we assume that younger the lady, better is her egg quality. In that sense, if a lady is less than 30 years old, with today's technology, we can expect 50% of these women to give us a pregnancy in their first attempt. Whereas if the lady is more than 40 years old, with her own eggs, the lady has maybe as low as a 10% chance of giving us a pregnancy. So as you can understand, there's a wide variation. It could be anywhere more than 50% to less than 10%, depending on what age are we doing the IVF and why we are doing the IVF. Again, we have to remember, younger you are, healthier the eggs and the sperms are, more the chances of pregnancy every attempt. Also, please do remember that the chances increase with multiple attempts. So, if the first one doesn't work, maybe the second or the third one may work for you, and you should continue to have patience. See, in most women, there are almost no side effects. But there are some side effects which have been reported with these fertility medications. You should be prepared that there could be headache or some vague body aches. There could be some vision problem in some women, a sense of bloating or swelling up in some other women, heaviness in your lower abdomen, heaviness in your breasts, shortness of breathing, maybe problem in passing urine after a few injections are over. So there could be some allergy issues in some women as well. But by and large, these are less than 2% in the population reported, and we should inform the doctor just as soon as we discover that we are developing any of these symptoms. The cost of medication usually is not and should not be included in the cost of the cycle, because medication requirement is completely individual, whereas the cost of the cycle is largely same for most of the patients. You have to understand that the medications are expensive and the dosage depends on the lady's body weight, her age, her AMH value reports, and a lot of other factors. Whereas the cost of the lab work is pretty much constant because the lab part is stabilized and standardized for most patients. So ideally the cost should include only the lab work. The medication should always be taken separately. Many times you will hear us talking about your day 1, day 2, day 3, etc. The start of menses is your day 1. For our understanding and our simplicity purposes, We tell you that if you menstruate or you start spotting on a day, that's your day 1. But if you do so after 4 p.m. of the same day, that's your day 0, and the next is a day 1. It's not about why we are calling it day 1 and why we are calling it day 0. It's just to standardize the whole thing, that we are calling the first day as day 1 and the next day as day 2. What you need to remember is, whenever you have your menses, depending on whether that's before 4 p.m. or after 4 p.m., you need to inform the phone number that has been given to you and accordingly come the next day for your mandatory blood tests and ultrasound. For most patients, you need to come to the clinic only on 3 or 4 occasions while your eggs are being grown or your stimulation is going on. You need to come every 3rd or 4th day for an ultrasound to find out if the rate of growth and the number of follicles is optimum. That generally requires less than 10 minutes of time at the clinic. Sometimes you need to stay for longer for some blood tests if they have been ordered, but that's about it as far as monitoring in these days is concerned. If you're talking of intra-city travel, yes, you can. If you're talking about out of the city travel, you can travel, but then you have to make sure that you take your medications on time and you report for the ultrasound as you've been asked to by your doctor. See, nowadays we are doing embryo transfer on 2 occasions. Sometimes in the fresh cycle, that's around 4-5 days after oocyte retrieval. And mostly nowadays the embryo transfer takes place in a frozen cycle, in a natural cycle. If it's a fresh cycle, the problem is that oocyte retrieval usually leaves behind enlarged ovaries. So then intercourse may be a little painful. So then we ask our couples to refrain for intercourse for the first couple of weeks after embryo transfer. Once the oocytes have been retrieved, the ovaries have become normal in size, she is most welcome to have her normal life as she desires. As far as a frozen embryo transfer or a deferred embryo transfer cycle is concerned, she can have a normal life all through the cycle. There is no prohibition at all. Egg retrieval takes place under ultrasound guidance. We put a needle through the vagina under ultrasound guidance, tap the ovaries and suck out the fluid from the follicles. That fluid contains the oocytes, which are then identified in the lab. As such, there is no cut or tear through the body, so there is no need for any pain. However, you could be embarrassed or you could have the sense of fear that something may go wrong. So many times, most women that we come across ask for a light anesthesia. We give them what is known as a daycare anesthesia, where we don't knock them out completely, but we make sure that their process comes across as completely painless to them. Once the eggs have been taken out, the egg retrieval takes around 10 to 15 minutes time. She comes back and she is completely normal. Some people may feel a heaviness thereafter for a couple of days, but that's because of the enlarged ovaries. The pain component, thankfully for most women, is absolutely zero. Once we do the embryo transfer, the embryo floats around in the endometrial cavity, that is the womb, for another 3-4 days and finally settles down. The earliest that we can come to know is around 8 to 10 days after embryo transfer is carried out. But what we tell our patients is to wait for 14 days after embryo transfer is carried out if it's a day 3 embryo, and wait for 12 days after embryo transfer is carried out if it is a blastocyst or a day 5 embryo, and then go for a blood test to find out she is pregnant or not. We ask you to refrain from using an ordinary urine pregnancy kit because the ordinary urine kits don't have very high sensitivity and early pregnancies may not be detected by the urine kit, and many people may stop their medications by seeing a negative results on the urine kit. So it's best to go for a blood test 14 days after an embryo transfer is carried out. See, we are a fertility clinic and we would like to focus on the fertility aspect of the patients only. Obstetrics or motherhood is a completely different thing. You require different sort of a care, your questions are different and your medications are different. So ideally, once you are pregnant, we'd like you to stay on with us for another couple of weeks till the time that we can detect the heartbeat in the baby, show that heartbeat to you, be happy and celebrate your happiness together, and then refer you to an obstetrician that you like and have known about. This is a question that gets asked very often. Till 2008-2009, when the freezing of embryos was with the cumbersome slow freezing method, the success rate of freezing embryos and then transferring was around 2/3 that of a fresh cycle. Over the last 6-7 years, what we are doing is we are vitrifying the embryos and then transferring these embryos. Believe me, with this vitrification technique, the success rate of frozen embryo transfer is actually either equal to or sometimes even better than fresh embryo transfers. What we tell our patients is, by freezing embryos and transferring them subsequently, they have a much better life and they can actually do what they want to with very few restrictions imposed on them. Natural cycle frozen embryo transfer is something that we are encouraging in larger numbers over the last couple of years. The patient requires to take almost no medication in a natural cycle, and the embryo transfer is carried out 5th day or 6th day of a spontaneous ovulation. This should and is also becoming the best method of choice for most couples. IVF and ICSI are almost the same because they serve the same purpose, that is forming of embryos. But there's a difference. In IVF, what we do is we put the female egg with around 40,000, 50,000 men sperms, hoping that one of these sperms will inject itself into the egg. So this is a natural selection of sperm of sorts. Whereas in ICSI, we take the sperm ourselves and inject it through a microinjector into the lady's eggs directly. So this is more direct and has a higher chance of forming embryos.